And welcome to the Good Leader podcast. I'm Will van der Hart, and this series on stress traps is seeking to help you to take steps to avoid significant stress in the future. And today I'm delighted to have our guest, Dr Chi Chi Obuaya, consultant psychiatrist both in NHS and private practice. Chi Chi, it's great to welcome you.
Always good to catch up with you, Will.
So today we're going to be talking a bit about exhaustion and burnout. And I'm a leader. We've been friends for a really long time. As you'll know, I've had my moments of feeling pretty burnt out, and you've been very kind. I phoned you and said, hey, I'm not doing so well. I know that my experience is really mirrored and echoed around Christian leadership really across the board. That's something that you've seen quite a lot of.
Absolutely. It's a common presentation. I think the first thing to say is that burnout and exhaustion, they're not diagnoses, They are phenomena that we see as clinicians. And the key thing is to understand what exactly is going on. So burnout has specific characteristics on its own, but it may indicate something else is happening from a mental health perspective. So for example, some people with burnout may actually have depression.
Okay, so there's a kind of potentially an on-ramp to more identifiable mental health conditions. Lots of leaders though would say, I'm not sure I'm there yet in terms of how I'm presenting, but I can definitely relate to terms like exhaustion or burnout. Do you want to define them a bit more in terms of what sort of features might be different between I'm just tired because it's a Monday morning and actually I'm suffering from something that feels harder to get over?
I think you hit on a really important point, which is that people can feel tired for a variety of reasons. So a leader in that context may actually see their GP or a mental health professional. And it would be important to think about other things going on beyond their mental health. So may they actually just be physically exhausted? They might need a blood test just to look at things like their blood count, which can indicate that they have a condition like anemia, which can cause exhaustion. From my perspective as a psychiatrist, I want to go as far back as we need to, and this may be many years before the apparent onset of the burnout, to find out what's been going on. I'd be wanting to explore the kind of external pressures an individual may be under, and I'm trying to then piece together a narrative which may then culminate in them feeling burnt out. In terms of what people may complain about, they may be tired, they might be quite irritable, not enjoying the work that they're doing as much, very impatient, and that's not necessarily at work. It might be at home with their spouse or their children. And there's an inability to recover. So normally we might think about the weekend as a time to recharge our batteries, but in spite of resting, they just don't quite feel that they're back in their groove when they get back to the workplace.
Gigi, I spend a lot of time as what we call sort of A1 type leader. They're quite driven, highly motivated, very visional. They're quite impatient to get things done, and they've often been, going flat out for as long as they can remember. Is there some commonality in the presentation of burnout to people like that?
Absolutely, those are classic ingredients for somebody to burn out. And I think the danger is, it's often when we reach the latter stages that we really notice the symptoms coming through. That is the problem, is that sort of approach will be successful in terms of getting a lot done, achieving, moving things forward. And so performance is maintained until a point that I call the cliff edge. So all the ingredients are there, but that person's performance is at the normal level. With a true burnout, there's a rapid and significant drop-off in their performance. So that's where the irritability really comes through, the lack of recovery and not feeling reinvigorated. That can take place within days or weeks.
So the presentation can get quite dramatic quite quickly, but the on-ramp to this, what's the sort of time scale, if there is one, that you would suggest is common for leaders to get to that point if they haven't been paying attention to their health and well-being?
It can be anything from up to 18 months, I should say, to 2 years.
Oh, really? Okay.
So it's a really long time. And the trick is that we often don't realize at the time, because one is achieving the things that are expected of a particular job. But there are a number of factors that one would look at which might just be thought about as red flags that burnout may ensue if that pace is maintained. Because I think we all know that we're not superheroes, and not getting enough sleep and packing the days in at some point is probably going to catch up with us. Having said that, a lot of people fall into the trap of getting very close to the point.
Yeah.
So some of the factors I would look for, we often throw out that term work-life balance, and we have to appreciate that it can be very difficult, particularly in a leadership position, to magic your way into a place of sanctuary on a regular basis. However, where there's a pervasive breakdown in that barrier between work and home life, the best example I can think of would be what happened during the COVID lockdown,
Right.
where people who were working from home had no leisure activities. There was nothing else to do. And for some leaders, that meant they would just keep on working, keep going through those emails, and there was nothing really stopping them because there was nothing else to do.
Yeah.
So that breakdown in the barrier. Another common trait we tend to find, going back to your point about the sorts of people that might be prone to burnout, would be those people who take on a high level of responsibility, but it becomes disproportionate.
Right.
So the idea that every problem has to be fixed by me, that I'm the only person who can get on top of this task and get it done, and losing sight of the fact that we often work in teams, and where things go wrong, assuming that it's something I've done that has played a role, rather than accepting that sometimes things are just challenging, circumstances are beyond my control.
So you've got hyperactivity, huge amounts of activity, high levels of responsibility, and the belief that I'm the only one who can make the wheels keep turning. It sounds quite similar to a lot of church leadership, maybe particularly church planting, when you think, I've got this very difficult task, feel very responsible for the task, I've got a huge amount of energy I need to pour into this in order to get the wheels turning, and that on-ramps a long time. I mean, I remember before struggling myself with burnout, I was really enjoying my job. In fact, I felt sort of hyper-energized in the job I'm doing. Is that something you see? People saying, I felt like I was doing great, and then suddenly I'm now in this difficult place.
And there's nothing wrong with enjoying the work.
Sure.
It's just being realistic about whether that can be sustained.
So this is quite an important point, I think, for many leaders who might be watching this podcast, because they might be thinking, but I'm loving my job, I love my work, I love pouring 100% into it, I'm feeling good right now, but they actually, according to your kind of diagnostic here, could be on the track towards a burnout experience, but they just don't know it yet.
Absolutely. So I would encourage someone in that situation to think about their whole self.
Yeah.
What makes up your identity? Work, clearly for a leader in this sort of situation, is going to be a big part of it, and there's nothing wrong with that. But what else are you? Mm-hmm. Are you a sibling, a child, a parent, a husband or a wife? What are your interests?
Yeah.
I think one of the big dangers is that we stop paying attention to those things that we sometimes take for granted, but those leisure activities, our friendships, the things that take us away from the work environment and are healthy to maintain. In the short term, there will always be, or often will be, demands on our time that mean we don't get to partake in those activities, but they're actually part of what helps to sustain us and give us that degree of balance, if that's the right word to use. So neglecting those is another red flag.
So what we're saying here is burnout or emotional exhaustion is a 18-month to 2-year process, and we could be enjoying our work, but if we're failing to pay attention to all those things that would give us kind of balance, rest and recreation, then we're likely to be on a trajectory somewhere we don't really want to be.
Absolutely, that's the case. If
we're thinking about, then I'm sure there'll be quite a few leaders thinking, oh my goodness, I'm not very happy about this idea. This doesn't make me feel very comfortable. let's think a bit more positively about how we can come back from the edge. So we talked about this sort of trajectory, and you said there are people who get quite close to the edge, but come back. So imagine there's a leader watching this right now, is thinking, well, I've been working flat out for a year. I've lost connection with my friends. I've given up my hobbies. I'm very irritable at home. I can feel myself on that kind of trajectory. What would you advise initially that they should start thinking about?
The short answer to that would be have a framework for actually addressing it, because it's not as simple as me saying, well, you should do more of this or less of this. I think that needs to be driven ultimately by the individual. Of course, some people like structure and a goal-oriented approach more than others. Some people can do this on their own, others might need some help. So that might be something that people need friends to go through with them, or maybe a professional counsellor. I'd be a little bit cautious about bringing in the obvious person who might be our spouse. I think there are pros and cons of doing that, in that a spouse may know that leader very well and be able to speak to the situation. But we also don't want to necessarily overburden them, number one. But also, I think there's something really helpful about having someone who isn't emotionally connected to you, who can just focus on the detail and look at things from a fresh perspective, and with the mileage that comes from supporting other people who've gone through this.
So an external support could be really helpful. A number of our leaders are single people as well, so they wouldn't necessarily have a spouse there to offer them that kind of guidance. I mean, I've certainly benefited hugely from external supports, and my wife and I decided, we are partners, we're not therapists. So being a partner to me and but not being my therapist is really important to keep the balance of a relationship between us. And I've benefited by receiving some psychotherapy, particularly, and that objective external perspective where someone's really for you and can help you see the traps of your own behaviour is really helpful. Also, I found there being personally quite a strong difference between mechanistic change, like me going, right, I need to go to the gym, or I need to do my hobby, or I need to see my friends, which is kind of quite defined in terms of outcome, to the actual drivers within me. So working out, like, why do I do what I do? Not just what do I do? And recognizing that, approval addiction, or, the desire to escape anxiety can be a very powerful force to kind of drive you towards burnout and breakdown. Have you found that to be true in people's experience that you've worked with?
It's a great point, Will, and I think it's going to vary from individual to individual. Absolutely, I do see that. I think for some people, the danger is that if you get into those motivating factors, they sort of go round in circles and it becomes an intellectual exercise without then the dynamic change that's needed. Right. And sometimes people need to have simple, reinforceable, goal-oriented activity that they can just clutch onto to get them going. However, I think it is also important, some people need to be that bit more reflective. So I'd say that's why I mentioned it's an individual approach, and it is about understanding what are the practical tools, but yes, what are the broader factors at play that might be driving that behaviour. So some people, it might be avoiding areas of challenge in their life and just burying themselves in their work. I'll give you one example that I do see in practice. I've seen that sometimes when people are going through a bereavement, rather than allowing themselves in a leadership position, allowing themselves that time and acknowledging that they do need to step away for a bit, there's this feeling that they can't, number one, but I think also there's an avoidance of the pain of going through grief that means people absolutely bury themselves in work. The danger again is that it will increase your productivity in the short term, but it's just difficult to sustain.
Chi Chi, that is really insightful and really, really helpful. We've got thoughts about the on-ramp in towards burnout and exhaustion. We've thought about drivers versus behaviours. We've thought about escape. All these things will be really common to leaders who are watching this podcast. And next steps for them would be reflecting and maybe putting some behavioural steps in place to help them recover.
Absolutely. I would encourage people to think about taking care of their self, and that's not selfish. That's actually an acronym, Will. So the S, sleep. Sleep is really key. We need that rest. E can stand for exercise. So it's a recognition of exercise and diet as things we can control. L is love. We need to maintain those emotional connections with people we care about, friends and family. And lastly, F for fun. It's really important to have fun. And work can be fun, but we've got to have those other things that just help to give us the sense of joy and reinvigoration.
Amazing. Chi Chi, thank you so much. Well, thank you for joining us today on the Good Leader podcast. Some really insightful wisdom from Dr. Chi Chi Obuaya on how we can work away from burnout and exhaustion towards a more positive and productive way of living. And hope that's the beginning of a helpful conversation for you. You might want to discuss that with peers, friends or family and make some positive steps towards a healthier and more sustainable outlook in leadership. God bless you. Have a really great day.